she was actually dying of leukemia. And before the break, we spoke with her parents about a revolutionary cancer treatment that brought her back from the brink of death. It had never been tested on a child before, Emma.
So scary. Really scary.
Really scary for the mouths of babes because the experimental treatment using HIV was Emma's only chance at surviving, and the process itself nearly killed her. Let's bring in Emma's oncologist, Dr. Steve Krupp, who helped pioneer this groundbreaking treatment along with senior medical correspondent Elizabeth Cohen. Okay, Dr. Krupp, I'm so glad to have you here because I think the first question, where did the idea of using HIV, even this deactivated version of the HIV, where did it even come from in the first place?
So thanks a lot for allowing me to answer your questions. So the treatment that Emma got was actually a cell therapy treatment. I think Tom and Carrie did a great to folks. What we do is we take cells called T cells. We take those cells out of the body. We expose them to a virus so we can put a new gene into the T cells. That's called genetic engineering. And then we put the T cells back into the body. We don't put the virus into the body. It is true that the virus started out as an HIV virus. And what we do is we take out all the parts of the virus that can cause disease and only leave the part that actually can put that new gene into the cell for the genetic engineering. This idea has been around for a while, but it's only recently that this sort of cell therapy has actually been helping patients.
So, as we understand that the process itself has a heck of a trajectory. I mean, it does a lot to the patient who has to go through the process. What are some of those examples of how difficult this was for Emma to endure?
Well, Emma did get sick as a result of her T-cell therapy. Everybody who has gotten this therapy so far who has responded to it, and 9 out of 12 people who have gotten it have responded, have gotten some degree of illness. They've gotten high fevers, they've gotten muscle aches, they felt like they had a terrible case of the flu. A few of the people actually did get sicker, and Emma definitely was one of those people. For a few days after she got her T-cell, she was actually sick enough to need care in an intensive care unit. But we learned something very important from Emma. We learned how to block the immune activation that was making her sick. She got better very rapidly after we treated her with a new medication, and since then she's been doing great.
So what she went through has helped you to deal with other patients. It's incredible. I want to bring in Elizabeth Cohen on this because when I read that the T cells turn into cancer serial killers effectively, it made me wonder, with all of the research that you do, Elizabeth, in this area, what applications might this have for all of the different cancers that are out there, and how to perhaps use some of this to treat those cancers?
Right, actually, you know what, this is really proof of principle, as Dr. Grubb said, that there was a response from 9 out of 12 of these patients with blood cancers, with lymphomas and leukemias. So the hope is that you can take this proof of principle and use it perhaps for other cancers, but we're not quite there yet. I mean, you don't move from an experiment like this on 12 people and move it on to every cancer, but the hope is that this principle will apply.
So let's talk a little bit about what her life is going to be like from here on in. Her parents were very careful, Dr. Grubb, to say that you never cure cancer. She's going to have to undergo a regular treatment. Is it for the rest of her life, and what exactly is it that she's going to have to undergo?
So first off, we don't like to use the word cure until enough time has passed. People are absolutely cured of their cancers, and we have every hope that Emma might be cured of her cancer, but we need more time to be able to say that for any person who's been treated with any kind of treatment, including this cell treatment. When we reach several years out from her treatment, if there's still no evidence of her leukemia, at that point we would say that she's cured, but she's only 8 months out from her treatment, and we need more time.
And I know, Elizabeth, you were curious about what happens in terms of a possible relapse and treatments. I know you wanted to ask the doctor a question too.
Right, Dr. Grubb, God forbid if Emma were to relapse and were to develop cancer again, can you use this treatment again since it worked so well on her the first time?
So the answer to that question is that there's no reason why we couldn't use it again. What we hope, actually, is that this kind of cell therapy treatment, because the cells stay in the body for a long period of time. I mean, we're 8 months out with Emma and more than 2 years out with some of the initial adults. We still see those cancer-fighting T cells in the patient. So as long as those T cells are in the patient, we have the possibility of preventing any potential later relapse. If, for some reason, her leukemia would come back, we would have the option to give these cells again.
Dr. Grupp, it's just a great story, and we're very thankful that you brought it to us. We're even more thankful that you did it successfully. Dr. Stephen Grupp and Elizabeth Cohen, thanks to both of you. Happy holidays.
Thank you very much.
So a little postscript on Emma. We told you that she's not with us today because she's in school. Got to go to school as a second grader. Apparently she is playing soccer, and she reads more than 4 dozen books per month, and she is loving being a kid.